So now we're talking about lactation. During pregnancy, progesterone and estrogen stimulate the growth of the milk-producing tissues in the breasts or the mammary glands. So you have here the nipple, the milk ducts, you have the skin, pectoral muscles, rib, chest wall, and the lobules, the adipose tissue, which means that these are the fat cells, and the areola. So during pregnancy, the high concentration of progesterone inhibits the production of the hormone prolactin from the pituitary gland. The fall in progesterone at the end of pregnancy means that prolactin is no longer inhibited. It now stimulates the production of milk. When the baby is born, oxytocin continues to contract the womb in order to restrict blood flow to the womb and reduce the risk of bleeding, and to help detach the placenta, which is delivered shortly afterwards. Blood levels of oxytocin and prolactin are very high, which supports bonding between the mother and the baby. Skin to skin and eye contact between the mother and the baby also stimulate the release of oxytocin and prolactin, further encouraging bonding. So as you have guessed correctly, it must be a positive feedback cycle. So oxytocin release is triggered by the stimulation of sensory receptors in the breast tissue by the suckling infant. And this creates a positive feedback loop that will result in continuous oxytocin secretion until the infant stops feeding. So the infant starts suckling. What happens? Oxytocin is released. And then once the little baby stops feeding, there will be no more oxytocin. And then we have prolactin, which is responsible for the milk production. And as long as the infant is suckling, there will be more prolactin. So let's try and recap this again. So stimulation of the nipple by the baby suckling initiates, the potential in the sensory neurons that connect with the hypothalamus. Here we've got the hypothalamus, and in response, the hypothalamus stimulates the posterior pituitary to release what hormone? Oxytocin. And the anterior pituitary to release prolactin. So oxytocin does what? The milk letdown, and prolactin does what? Milk production. So oxytocin stimulates milk release from the breast, and the prolactin stimulates additional milk production. So if a mother doesn't have enough milk, it might be helpful if the baby is just suckling a little bit longer. So many mothers describe being in a euphoric state just after labor, and this is due to the effects of oxytocin, prolactin, and beta endorphins. The first formed milk is called colostrum. It is high in antibodies, which give some passive immunity to the newborn baby. It is made in pregnancy and for the first few days after birth. It varies in color, but it may be thick and yellowish. As the baby suckles, the tissue around the nipple is stimulated. This causes nerve impulses to pass the hypothalamus of the mother's brain. As a result, the posterior pituitary gland secretes oxytocin. This causes the muscle in the walls of the milk ducts to contract, squeezing milk out of the nipple into the baby's mouths. It also causes the anterior pituitary gland to secrete more prolactin, stimulating the production of more milk. Prolactin also inhibits the production of FSH and LH. As a result, ovulation is unlikely while a mother is breastfeeding a baby full time. Later on, the milk produced will be greater in volume. Milk varies in its precise composition from mother to mother and from feed to feed. All a mother must do is feed in response to the cues a baby gives. Milk is made in response to its removal from the breast, and this is why mothers of twins or more can make sufficient milk to nourish all of their babies. The more milk is removed, the more milk is made. So tables and timers are not very helpful in this stage. Some women are unable or choose not to breastfeed their baby. Wet nursing used to be common among the people in the 19th century, especially among rich people. Nowadays, wet nursing is controversial. There are concerns that wet nurses may pass on infections through breastfeeding. So let's stay a little bit longer at the hormone oxytocin. It has another crucial role to play after birth. Oxytocin causes the contractions that lead to separation of the placenta from the uterus and its release as the afterbirth. When oxytocin levels are high, strong contractions occur that reduce the chance of bleeding. Putting your newborn baby to your breast is the easiest way to increase oxytocin levels. So privacy during the hour following birth is important. This gives the opportunity for uninterrupted skin-to-skin and eye-to-eye contact between mother and baby, conditions that optimize oxytocin release. Oxytocin also helps us in our emotional as well as our physical transition to motherhood. From the first weeks of pregnancy, oxytocin helps us to be more emotionally open and more receptive to social contact and support. As the hormone of orgasm, labor, and breastfeeding, oxytocin encourages us to forget ourselves either through altruism, service to others, or through feelings of love. Catecholamines levels drop quickly after the birth, the flight and fight response, which can make a mother may feel cold or shaky. At this stage, a very warm atmosphere is essential to keep these CA levels low and to allow oxytocin to work effectively to prevent bleeding. We don't want the mom to stress. Prolactin, and other childbearing hormone, is also noteworthy for its effects after birth. Prolactin is the major hormone of breast milk synthesis. Suckling by the newborn baby increases prolactin levels. Early and frequent suckling from the first days makes the breast more responsive to prolactin, which in turn helps to ensure a good long-term supply of milk. Like other hormones, prolactin has effects of emotion and behavior. It helps us to put our baby's needs first in all situations by increasing submissiveness, anxiety, and vigilance. When prolactin is combined with oxytocin, as it is soon after birth and during breastfeeding, it encourages and relaxes and selfless devotion to the baby that contributes to a mother's satisfaction and her baby's physical and emotional health. Like oxytocin, endorphin hormones can include euphoria and are also releasing during lovemaking and breastfeeding. In fact, endorphins are actually present in breast milk, which explains the natural high that babies can get after a breastfeed.